Hang on just a second.
All right, I'm in. He left.
He's back.
Mr. Barnes, I'd like to thank you for your support of the trust when you get up. That's the word we see. So,
Oh, yeah, absolutely. Yeah, there you go. Hopefully I can stay out of that arena. Yep. Do we know if Mr. Blau is going to join us today, or are we going to have Mr. Compton?
he's here.
Oh, I see him. Yeah, very good.
Ask him to stand up.
All right. Are we ready to go?
Yes.
Okay, very good. Welcome. Thank you for your attendance. Emergency Response Committee for Oklahoma County. And I'll do a roll call real quick. Barnes is here. Mr. Matthews.
President of the BOCC meeting room.
Mr. Blau.
Here, President, BOCC.
And Mr. Dodson on behalf of Michael Taylor.
Present.
And Mr. Davidson.
I am present.
Very good. Thank you all. I believe the first item on the agenda is discussion of possible action to set date, time, and place. The meeting will reconvene in the event technical difficulties arise in the course of this meeting and cannot be corrected within a maximum of 30 minutes.
Hey, David,
Yes, sir.
about a motion to return to recess.
Oh,
Can't hear you, Joe.
Motion to return from recess.
second.
That's probably a good idea. Got a motion to return from recess. Mr. Matthews,
Aye.
Mr. Blau,
Yes.
Mr. Dodson,
Aye.
Mr. Davidson,
Aye.
and Barnes is an aye. Thank you, Joe. Feel free to ring me in occasionally. All right. Item, discussion possible action, set date, time, place, meeting will reconvene in event of technical difficulties. And should they arise during the course of this meeting, cannot be corrected within a maximum of 30 minutes.
I'll move 1:30 today.
There's another committee meeting at 1:30 today. There's another committee meeting at 1:30 today.
Okay.
I withdraw my motion.
We'll pick Joe's favorite time. How about 2 o'clock today?
I'm going to suggest 10 o'clock in the morning.
Tomorrow?
I could be BOCC, most of us.
Oh, yeah, we do have BS. Yeah, that works.
10
Second.
a.m. tomorrow morning.
Second.
I'm sorry, what time tomorrow morning?
Oh, excuse me, 10 a.m.
10 o'clock Wednesday morning. And I believe I heard a second from
Yes,
Mr.
yes.
Davidson. All right, motion and
Yes.
second. Roll call, Mr. Matthews.
Aye.
Mr. Blau.
Yes.
Mr. Dodson.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. So should the need arise, we will reconvene 10 o'clock Wednesday. All right. Next item, discussion, review, and possible action regarding presentation from emergency management health safety professionals regarding an update on COVID-19 coronavirus. And my report is as follows. Again, stay at home greatly reduces your chances of exposure and reduces your chances
Mr.
of
Barnes?
exposure to others. Yes, sir.
Mr. Barnes. Motion to reopen item number three.
We should make up my mind. Okay, motion and second. Mr. Matthews.
Aye.
Mr. Blau.
Aye. Aye.
Mr. Dodson.
Aye.
Mr. Davis.
Aye.
And Mr. Barnes is an aye. Now may I.
Other you may. Hold on.
I've had my coffee this morning. We're good. All right, stay at home greatly reduces your chances of exposure and greatly reduces your chances of exposing others. Persistence in preventative measures is more important now than ever. Again, I'd reemphasize, as we did, that we don't want to get apathetic or complacent as we continue to move through this for long term. President Trump's stay-at-home guidelines currently extend through April 30th, all 50 states, and that is included in a presidential disaster declaration. And Oklahoma is currently under a major disaster declaration and a catastrophic public health emergency, including all 77 counties. And this includes the public assistance category provided funding for emergency protective measures and direct federal assistance for state and local governments as they respond to the COVID-19 emergency. And seeing lots of correspondence among different offices. I think Christy may be with us today as well, regarding the CARES Act and stimulus funding. And to clarify that a little bit, based on the information I'm seeing and the various emails and things flying around, apparently Oklahoma County is eligible. We had some clarification that was had to receive to determine that, but we are apparently still eligible, and this is not disaster declaration related funding. In Oklahoma, we are now with 2,184 positive test results, 108 fatalities. I would remind that 88 of those 108 fatalities, or 81% of those, are 65 years of age or older. The largest numbers in Oklahoma County, 19, Tulsa County, 19, Cleveland County, 17. And again, a reminder, there have been 83 seasonal flu deaths since September 1st of 2019, with 0 since the end of March. 26,085 negative test results as of the 10th of April, not including private labs. We currently have 488 cumulative hospitalizations. And there are 64 counties with positive cases. There are now increased up to 81 drive-through test sites in operation around the state. Hours of operation and prerequisite requirements, if any, vary in some locations. And you can go to the State Health Department website to get specific information on the various sites. The Oklahoma City County Health Department site is now considered a non-medical referral site, meaning that you don't have to go to a physician to get an appointment, but you do have to meet specific testing guidelines. And their triage line is still 425-4489. And that's available Monday through Friday, 8 to 4:30. And they encourage to not show up without an appointment. And I did check with City County Health Department, and they are again scheduling. They've apparently taken care of their backlog, and they are back up to speed and taking current appointments. I mentioned that we're under a gubernatorial declaration, and that's all 77 counties. Social distancing guidance still in place, closure of non-essential businesses, delay of elective surgery, minor medical and non-emergency dental procedures. Nursing homes and long-term care facilities are off limits to the general public. And public safety answering points or 911 centers are still receiving addresses where positive cases have been identified. And this is now currently under the declarations as allowable. It's a relaxation of the HIPAA guidance to allow protection for first responders. They provide no personal information, only an address upon being dispatched to that site to indicate that that has been a positive test location. Projected peak for Oklahoma is still looking into next week for the Institute for Health Metrics. It's also available. DHS continues working on several plans, and as I've mentioned, Christy Jernigan Marshall with Oklahoma County Social Services is very engaged in keeping me advised. We exchange information on a daily basis, and there's more information to come. If you were involved, and I think all of you or most of you were, with the policy and governance this morning, you heard Christy provide some great updates in that regard. I'm not going to reiterate all those points, but the shelter operations continue moving forward. I like the aspects that she mentioned about the on-site shelter testing capabilities are being evaluated, but they do perform an initial screening of all intakes there, which is a very good thing. And I think it's a point to keep in mind. She mentioned that the infectious diseases typically hit that population a little later than the general population, and typically a little bit more intense as well. So that's something to certainly keep in mind. Severe weather sheltering. We saw several instances of tornadic activity in multiple fatalities over the Easter weekend, and severe weather sheltering definitely complicates social distancing, particularly if they're involved in the use of public shelters. But social distancing is still something that is important to heed if in fact you can in those situations. Report from the Department of Corrections remains that 5 staff members and 1 inmate have tested positive. Interesting note, the state is now working with the Council on Law Enforcement Education and Training, or CLEAT, to potentially use CLEAT dorm rooms for inmates that may test positive. In Oklahoma County, we have 474 positive test results with 19 fatalities. Tinker Air Force Base now is reporting 18 positive cases. They have restricted visitor guidance in place, and there are revisions in the available gates out there. For information, Oklahoma City County Health Department Nurse Hotline at 425-4489 and State 24-hour hotline is available at 877-215-8336. And you can set your phones or personal electronic devices up to receive direct updates from City County Health Department. Information is available at their website. On the alternative care homeless shelters and alternative care site initiative, which are 2 separate issues, I mentioned some of what Christy's been working with. I know she has a lot of meetings, a lot of conference calls, a lot of webinars. She's been very engaged in that process. Those continue to move forward, and the strategies that are being employed there are quite extensive, and I know that the expertise that many of those entities and agencies, along with Christy, bring to the table is of great value. Some additional facilities outside of the City Rescue and Grace Rescue mission. And these facilities are typically going to be utilized for first responder or healthcare providers requiring quarantine, include OU, OSU, SNU, UCO, and Oklahoma Christian have all been involved in those discussions. PPE is still a concern for first responders, but some supplies have been arriving and are being distributed. Oklahoma County Emergency Management point of dispensing or point of distribution has been implemented. We're using all of our staff members and several Oklahoma County Emergency Management volunteers. We've already received 3 deliveries of first responder PPE, and those distributions have been completed, including to 24 entities with local jurisdictions, meaning law enforcement, fire rescue, and emergency management. We're also providing to 3 additional counties plus OBU, UCO, and the Oklahoma County Sheriff's Office, Oklahoma County Jail, and Juvenile Justice. I had some questions this morning about resources going to the jail, the Sheriff's Office. Just in one delivery last week, the jail received 1,300 masks, 100 face shields, 100 gowns, and 20 bottles of sanitizer, and the Sheriff's Office received an additional 1,100 masks. And those mask counts were actually providing the N95s as well as surgical masks. So there's 2 different types of masks that are being provided there. Oklahoma City government still through April 17th taking applications for small businesses within the city limits to apply for disaster relief. And I reiterate, that is not related to the FEMA Presidential Declaration disaster funding. And County Health Department is requesting donations of pen lights, gloves, gowns, lab coats, face shields, masks, safety glasses, biohazard bags, and hand sanitizers. Those with those resources are wishing to be involved in those donations can get additional information at the Oklahoma City County Health Department website. Internal Oklahoma County government, ReadyOp continues to be emphasized. Registrations are encouraged. We are still under an emergency declaration that was approved at the March 25th Board of County Commissioners meeting. The Oklahoma County Court Clerk Office is again reiterating the marriage license procedures to bring the paperwork already prepared, and an appointment is necessary for that. And I've been advised of 140 people through the door yesterday, April 13th. And I think a great deal of that, according to my discussion with the deputies at the front door, is in regard to the VPO activity, which is apparently continuing to escalate. And I'm advised that there will be 65 inmate shuttles today. Some notable, Oklahoma Medical Reserve Corps, which is a tremendous asset in not only, these type of events, but in other events, is currently soliciting for medical and non-medical volunteers. And there are a lot of opportunities available there. You can contact OKMRC for more information or to volunteer. Warning signs, symptoms, trouble breathing, persistent pain or pressure in chest, new confusion or inability to arouse or awaken, bluish lip or face, and persistent fever. And I would emphasize that not necessarily all of those factors would be present for someone who could potentially be positive, and they may not have all of those factors. In fact, there are still many people who are being identified as positive cases who are asymptomatic. So there's a lot of variety there. Personal protective measures remain consistent, including frequent hand washing, covering the cough or sneeze, social distancing, staying at home, and a recommendation to open packages outside of the home or work area, disinfect items, and discard shipping materials without taking them in the workspace or the home. American Red Cross and Oklahoma Blood Institute still indicating that blood supplies are low and they are in need of donors. We still continue to deal with false information, and social media should be quite careful with that and make sure you're using known credible sources. Authorization letters for essential services or essential personnel are currently not being issued or required in Oklahoma in any jurisdiction that I am aware of. Encourage viewing statistics realistically and the projections as we continue to see the dynamics involved there. Lots of media reports about the ambiguity regarding what's coming up with the projections and the numbers and the accuracy of that information. So I just encourage people to be very careful with projection numbers and statistics that are being provided in a variety of sources, and just be careful with that information. At our meeting yesterday, we talked about drafting information to be provided to department heads, BOCC departments, and elected officials regarding possible reentry and repatriation at Oklahoma County. I've worked for a couple of hours this morning on a draft of that I'll be providing to the members of this committee shortly after lunch, and solicit your input and any comments or suggestion in regard to information I have in that. Look around my piles here real quick. Yeah, I think that concludes my report for now, unless there's any discussion or any questions.
David, regard to the item that you spent some time working on and you're going to send out to us, any discussion related to that needs to occur in this meeting?
Okay, so I would, give your guidance in that regard. You're saying not to send that document out to the members of the committee, but
No, sending it out is fine. Soliciting individual feedback from us.
Yeah, exactly, absolutely.
Providing that outside of this forum.
Yeah, that's what I intended to do, Joe, and I appreciate your guidance. I was going to provide that and solicit individual input back from any member who wants to provide such, and then bring it up as a topic of discussion during my report at our next meeting.
Mr. Chairman,
Yes, sir.
when you're considering the repatriation of the employees and such, have you considered looping in the judicial aspects and speaking with them? Because I don't know, I just don't know what they're going to want to do when they start cranking court back up.
Yes, sir. Actually, go ahead. I'm sorry.
Pause that they would take into consideration pausing the jury assembly or the jurors, bringing 500 additional people down here. If we could avoid that, that'd be nice.
Yes, sir. And
For a while.
the guidance I'm pulling together currently is somewhat generic. It does not address a specific function or department or discipline. There's limited guidance because we're kind of early in the reentry aspect from a national perspective and certainly a state perspective. But the guidance that I'm finding and what I'm writing into this document, you'll see is in a broad scope. It deals with some generalized practices, primarily from the health perspective, since this is a health issue. And it also deals with continuity of operations planning and recouping various pieces of information that we hopefully have observed and are documenting as we move forward and get ready to do the reentry piece.
David, you mentioned earlier the CARES Act and some assistance available to state and local governments. And you also mentioned that you thought Christy was here. She here. And with regard to those funds that might be available, I think it would be beneficial for the county, for the VOCC to consider a special meeting to apply for those funds. So I don't know, Christie, do you have anything?
Do you think it should be a BOCC meeting, or can we accomplish this? Do we have time to accomplish this on the budget board?
As I understand it, the deadline is the 7th.
Yeah.
VOCC being the body policy, that's the appropriate entity to
Okay.
apply.
Yeah.
And so then when the funds come in, there's specific things that they can be used for, only related to COVID-19. They couldn't have been for a current year as of March, I think, approximately. So Christy may have more.
Actually, you did a great job with all the that went around when that information came out today. I think we clarified a lot of. Before today, I was Friday at midnight. I would think that it would be BOC, and the chairman would be the one to actually sign the certificate for submission. I will forward all the information that needs to go along with that certificate. It's the DUNS number, it's our ID, and then our bank information. I think that to the chairman.
And we could get that, I think we could probably get that started
Yeah, we just call it for Friday.
on Friday. 48 hours, so just now 12:30.
Yeah. Send an email calling it right now.
Okay. Chrissy, thank you. That's all I have, David.
Okay. Any other discussion in regard to my report?
Can you do me a favor and email out the PPE numbers that were delivered to our emergency management and our sheriff, both detention and deputies?
Yes, I can. I'll be sending you a spreadsheet and you'll see what we received and what was distributed and where it went.
That's perfect. Thank you.
You bet.
Motion to receive report.
Second.
Got a motion second to receive report. Roll call, Mr. Matthews,
Aye.
Mr. Blau,
Aye.
Mr. Dodson,
Aye.
thank you, sir, and Mr. Davidson.
Aye.
And Mr. Barnes is an aye. Thank you very much. Motion to reopen item number 4, discussion, review, and possible action regarding presentation from BOCC departments. Anyone present to make a presentation or provide information, or any emails or other information available?
I don't see anyone standing up, David. I don't know if we need to necessarily do. Miles, are you aware of anything? Dan?
No, unless somebody's online that would want to share.
MIS is here. I was just going to update kind of the same thing I did with policy and governance, but it's not necessary.
Second, move to reopen item 4.
Second.
Got a motion second to reopen item number 4. Mr. Matthews,
Aye.
Mr. Blau,
Aye.
Mr. Dodson,
Aye.
Mr. Davidson,
Aye.
and David Barnes is an aye. Sir, report from MIS. Go ahead, Rich.
Much like I gave the update earlier, we did notice this morning that we had some problems with our VPN connections. We tracked it down and figured out that it is most likely we had a disruption with the Cox internet service provider. That has since smoothed out, and we are no longer experiencing any problems. But we did run into that issue this morning.
Okay. Very good. Thank you, sir. Any questions or further discussion for Mr. Stewart?
Motion to receive.
Second.
Got a motion and a second to receive the report. And roll call, Mr. Matthews,
Aye.
Mr. Blau, Mr. Dodson,
Aye.
Mr. Davidson,
Aye.
and Barnes is an aye. Thank you all very much. Item number 5, discussion, review, and possible action regarding a presentation from facilities management. Is there anyone available? Okay. Motion to reopen. Do I hear a second?
Second.
And roll call, Mr. Matthews.
Aye.
Mr. Blau?
Aye.
Mr. Dodson?
Aye.
Dodson?
Oh, aye. Sorry. Josh.
And Barnes is an aye. Thank you. Reopening item number 5. Someone
Yeah.
facilities management.
Yeah. My bad.
We've
The
begun
mental delay.
trying to assemble signage posted in the elevators. There are agenda items, my understanding, for tomorrow's BOCC meeting, meeting, to discuss that. Ample of signage in place in the elevators. States, for your health and those around you, limits, in this case, 2 people per elevator car. Also, we begin to take off locations on the floor, the elevator lobbies, and also on the street side of security checkpoint in front of the annex. Trying to maintain a distance of 6 feet that allows for individuals.
Let it be noted that this is not on any mobile device, and we're having this today.
That was my problem. I was on a mobile device.
Anyhow, 20 individuals can be accommodated in the vestibule on the street side of the security checkpoint. That's my guess, probably a third of those have their ordinary.
I saw that and appreciate you doing that, but I got a question. We did front to back 6 foot. Did you take into consideration side to side? Because I keep noticing it online at places that are doing great front to back 6 foot, but then they'll be side by side at checkout.
With those lines per team,
Yeah,
your take marks are staggered.
great. That's great. Thank you. Excellent work.
Thank you, Mr. Monroe. Any further discussion or questions for facility maintenance?
Motion to receive report. Second.
Got a motion and a second to receive report under item number 5. Roll call, Mr. Matthews.
Aye.
Mr. Blau. Mr. Dodson.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Item number 6, discussion review possible action regarding presentations from Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor's Offices. Anyone present or wishing to otherwise provide information?
Christie's shaking her head no.
All right. Thank you for your input a while ago, Christie. Hearing none, no action on item number 6. Item number 7, discussion possible action to determine the next meeting date and time. I believe we have a formal meeting set for Monday, the 20th at noon, if I'm not mistaken. Is that correct?
Yes.
Is there a desire to recess this meeting?
So moved. Recess till noon, April 15th.
What the heck day is that?
Tomorrow.
April 15th at noon. There's been some discussion about possibly because of the frequency of updates and new information of looking at going to a every other day format. I'm totally wide open to whatever is the pleasure of the committee. That discussion included possibly moving to convene from today until Thursday, and then next week maybe getting on a Monday, Wednesday, Friday schedule. But again, I'm completely wide open, whatever is the pleasure of the committee. We want to continue on a daily. I'm fine with that. We can reconvene at noon Wednesday.
I like the idea of doing the every other day, but the ability and purpose of this committee being able to respond quickly to something that could take place. I don't know that 24 hours, if it hurts anything or any, I don't know what everybody's feelings about that are, but
Yeah, I'm good either way.
meeting every day kind of allows you to respond in a quicker manner, but either way.
All right, do you hear a motion to recess until noon Wednesday, the 15th?
So moved.
I'll second.
Got a motion and a second. Roll call. Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Dodson.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Thank you all for participation today. I will be getting that email out to you in a very short time frame and would appreciate your input back. You'll have a great day. See you tomorrow.
You too. Thank you. Bye.
Thank you.